Hello guys, it's Mark at Lismore House Dental Practice. I'm just going to have a chat with you now just about 7 common mistakes that I've identified that people often make when seeking a dentist for treatment in general, but especially for smile makeovers, trying to achieve perfect straight teeth, clear aligner therapy, general orthodontics. So number 1, credential check. Make sure that the dentist that you choose is up to the job. Have they had appropriate training? Are they skilled? Are they experienced? Make sure that they offer the treatment that you want and are skilled at delivering that treatment. Number 2, referrals. So ask around, ask friends, family, check that people who have been through the treatment that you're going to go through are happy with not only the treatment they've received, but the service that they have received at that practice. The number 3 issue, the third issue I should say, is cost-driven choices. Now, cost always plays a part in any decision, but making it the number 1, the driving choice, is often a mistake. Make sure that the perfect grin doesn't become a grimace. Make sure that you're not just going cheap. You're going for something that should last a lifetime. Therefore, it's penny pinching to get a less than ideal outcome. Is that money well spent? Is it money well spent if you have to get it done again? And we do see that. There was a particular online company that I won't mention that went bust, and we've seen patients coming in to get that rectified. And there's an old saying, buy cheap, buy twice, and it's often the case, sadly. So don't let cost be the driving factor. Obviously it's a consideration, but there's more to it than that. Now, researching as well. So in this instance, the internet can be your friend. Look online, Google reviews. Your dentist could have a good social media presence. It's one thing I'm guilty of. I need to get better at it, but you want to see evidence of the clinician's work that you are choosing. And then that goes back to the point I was saying about asking friends. Word of mouth is king. It's word of mouth is best, people that you trust. But second to that, Google reviews, online presence, that sort of thing. Questioning the clinician for full clarity. Now, I'm a great believer that there is no such thing as a daft question, only a daft answer. I really encourage my patients to ask as many questions as they like. If you're getting clear aligner therapy or any sort of major treatment with me, you will get my phone number. Often when you're in the chair, there can be a slight element of white coat syndrome. We try to avoid it. We have a very relaxed, informal atmosphere at Lismore House just to try and break those barriers, but it can be that you go away and you think, damn, why did I not think of that? Ask as many questions as you need. And I'm a great believer in giving you my phone number, and you can, 10 o'clock on a Saturday night, something pings into your head, just send me a WhatsApp. I might not get back to you straight away, but I will get back to you. So questions, you need to ask as many questions. If you've got a question in your head, just ask it. Like I say, there is no such thing as a silly question, only a silly answer. Communication skills, you need a dentist that can communicate with you. And second to that, I don't believe in formality. You might notice that. I believe in having a skilled clinician, but to me there is no hierarchy in the surgery. A hierarchy just creates barriers, and barriers are not good. You need to be on a level plane with your dentist. You need to be able to ask them as much as you like. You need to be able to communicate with them freely. You don't want them taking offence if there's a tooth that you're not quite happy of the position of. If you reach the end of your treatment and you're not quite happy, you need to communicate that. Don't bottle these things up. And equally, you need a dentist that is happy to communicate freely with you. And beyond that, there's sometimes patients can overlook the whole patient experience. You're not just buying a product from a shop. You are going to form a bit of a personal relationship with your dentist, with the reception team, with nurses. You're going to be coming frequently to the practice, so you want that practice to be relaxed, friendly, happy. You want the waiting room to be nice. Can you have a cup of tea, a cup of coffee? Is it nice and warm? Is it clean? Is it well decorated? Are you treated as an individual, not a number? It's not in and out, in and out. It's come in, meet Sarah, meet myself, become part of the Lismore family for however long that takes. It's a big, big thing, you know, patient journey. It really is, and it's often overlooked.